Now, there is increasing concern over a majority of Kenyans who have decided against seeking medical attention in hospitals, albeit their health status requiring them to do so, over suspected safety considerations. The Ministry of Health has disclosed that hospitals have registered a decline in numbers, particularly that of patients requiring surgical services. Health Chief Administrative Secretary Dr. Mwangangi is therefore appealing to Kenyans to visit medical facilities in spite of the COVID-19 pandemic for their own good. The rallying call coming as the country's COVID-19 tally shot up to 29,849 cases after 515 cases were reported from 6,353 samples tested. Well, Nancy Okware with that report.
The Ministry of Health is hugely concerned by a decline in number of patients seeking medical services at the various hospitals, in an apparent reference to widely circulating fears that medical facilities may not be safe during this period of pandemic. Health Chief Administrative Secretary Dr. Mwangangi says that all safety guidelines had been put in place to facilitate sound procedures that secure the statuses of both the doctor and the patients.
We need to emphasize and remind them that these services are available and that they should not be afraid.
And the abnormal thing here is, I'm a surgeon myself. All I know is initially, or before COVID, we never used to advise to have patients wearing masks. But today, our patients are also wearing masks, just as the surgeon.
The CA is adding that a COVID-19 test was not mandatory for emergencies that require immediate surgery.
However, for emergency surgical cases, as would happen in the case of road traffic accidents, as would happen in the case of complicated deliveries where a mother needs to have a cesarean section, it is expected that care would be provided without a COVID-19 test.
However, the ministry says that there has been some positive response among patients seeking antenatal services, especially between the months of May and June.
For antenatal care services, it seems mothers have now started going back. We're happy to report even for deliveries in a hospital, mothers have started going back to deliver in a hospital.
The appeal coming as the number of positive cases rose to 29,849 following the confirmation of 515 cases resulting from 6,353 samples tested. Nairobi had 251 cases, followed by Kitui with 41, Kiambu 33, Kericho 23, while Kisii had 19 cases.
It all comes down to individual decisions that each and every one of us is making to keep himself and others in the community safe.
672 patients were discharged after making full recovery, out of which 607 were from the home care program. However, the number of fatalities rose to 472 after 7 more patients succumbed to the virus. Even as the country and the world at large continues to battle the effects of COVID-19, the Ministry of Health is cautioning against laxity when it comes to seeking other medical services, with the health officials calling on Kenyans not to shy off as the hospitals and the services are safe. Nancy Okware, Channel 1 News.